Hey Alpha Nurses, I'm Nurse Sandra from alphanurseguide.com. This is NCLEX PN Review Lesson 26, Eye Disorder Questions. You can follow me on Facebook, Instagram, and TikTok to get any updates. All links are in the description. Without the way, let's get started.
Question 1. The nurse is reinforcing home care instructions to a client and family regarding care after cataract removal from the right eye. Which statement made by the client indicates an understanding of the instructions? A. I should not sleep on my left side. B. I should not sleep on my right side. C. I will take aspirin if I have any pain. D. I should not wear my glasses until my surgeon says it is okay. The correct answer is B. I should not sleep on my right side. Rationale: after cataract surgery, the client should not sleep on the side of the body that was operated on. Clients should be instructed not to take aspirin or any medications that contain aspirin because of their antiplatelet properties that can increase the risk of bleeding. Acetaminophen can be taken as needed for pain. Clients may wear their glasses. Question 2. The nurse is preparing to reinforce a teaching plan for a client who is undergoing cataract extraction with intraocular implant. Which home care measures should the nurse include in the plan? Select all that apply. A. To avoid activities that require bending over. B. To contact the surgeon if eye scratchiness occurs. C. To place an eye shield on the surgical eye at bedtime. D. That episodes of sudden severe pain in the eye are expected. E. To contact the surgeon if a decrease in visual acuity occurs. F. To take acetaminophen for minor eye discomfort. The correct answers are A. To avoid activities that require bending over. C. To place an eye shield on the surgical eye at bedtime. E. To contact the surgeon if a decrease in visual acuity occurs, and F. To take acetaminophen for minor eye discomfort. Rationale: after eye surgery, some scratchiness and mild eye discomfort may occur in the operative eye and is usually relieved by mild analgesics. If the eye pain becomes severe, the client should notify the surgeon because this may indicate hemorrhage, infection, or increased intraocular pressure. The nurse would also instruct the client to notify the surgeon of purulent drainage, increased redness, or any decrease in visual acuity. The client is instructed to place an eye shield over the operative eye at bedtime to protect the eye from injury during sleep and to avoid activities that increase intraocular pressure, such as bending over. Question 3. The nurse is assisting in developing a teaching plan for the client with glaucoma. Which instruction should the nurse suggest to include in the plan of care? A. Decrease the amount of salt in the diet. B. Decrease fluid intake to control the intraocular pressure. C. Avoid reading the newspaper and watching television. D. Eye medications will need to be administered for the rest of your life. The correct answer is D. Eye medications will need to be administered for the rest of your life. Rationale: the administration of eyedrops is a critical component of the treatment plan for the client with glaucoma. The client needs to be instructed that medications will need to be taken for the rest of his or her life. Limiting fluids and reducing salt will not decrease intraocular pressure. Option C is not necessary. Question 4. The nurse is assigned to care for a client with a detached retina. Which findings should the nurse expect to be documented in the client's record? A. Blurred vision. B. Pain in the affected eye. C. A yellow discoloration of the sclera. D. A sense of a curtain falling across the field of vision. The correct answer is D. A sense of a curtain falling across the field of vision. Rationale: a characteristic clinical manifestation of retinal detachment described by clients is the feeling that a shadow or curtain is falling across the field of vision. There is no pain associated with detachment of the retina. A retinal detachment is an ophthalmic emergency, and even more so if visual acuity is still normal. Options A and C are not specifically associated with a detached retina. Question 5. A client arrives in the emergency department after an automobile crash. The client's forehead hit the steering wheel, and a hyphema has been diagnosed. Which position should the nurse prepare to position the client? A. Flat on bed rest. B. On bed rest in a semi-Fowler's position. C. In lateral position on the unaffected side. D. In the lateral position on the affected side. The correct answer is B. On bed rest in a semi-Fowler's position. Rationale: a hyphema is the presence of blood in the anterior chamber. It is produced when a force is sufficient to break the integrity of the blood vessels in the eye. It can be caused by direct injury, such as penetrating injury from a BB pellet, or indirectly, such as from striking the forehead on a steering wheel during an accident. The client is treated by bed rest in a semi-Fowler's position to assist gravity in keeping the hyphema away from the optical center of the cornea. Question 6. The nurse is assigned to care for a client with a diagnosis of detached retina. Which finding would indicate that bleeding has occurred as a result of retinal detachment? A. Total loss of vision. B. A reddened conjunctiva. C. A sudden sharp pain in the eye. D. Complaints of a burst of black spots or floaters. The correct answer is D. Complaints of a burst of black spots or floaters. Rationale: complaints of a sudden burst of black spots or floaters indicate that bleeding has occurred as a result of the detachment. Options A, B, and C are not specifically associated with bleeding as a result of detached retina. Question 7. A client sustains a contusion of the eyeball after a traumatic injury with a blunt object. The nurse should take which immediate action? A. Notify the healthcare provider. B. Apply ice to the affected eye. C. Irrigate the eye with cool water. D. Accompany the client to the emergency department. The correct answer is B. Apply ice to the affected eye. Rationale: treatment for a contusion begins at the time of injury. Ice is applied immediately. The client should receive a thorough eye examination to rule out the presence of other eye injuries. Eye irrigation is not indicated in a contusion. Options A and D will delay immediate treatment. After the application of ice, the HCP would be notified. Question 8. A client sustains a chemical eye injury from a splash of battery acid. The nurse should prepare the client for which immediate measure? A. Checking visual acuity. B. Covering the eye with a pressure patch. C. Swabbing the eye with antibiotic ointment. D. Irrigating the eye with sterile normal saline. The correct answer is D. Irrigating the eye with sterile normal saline. Rationale: emergency care after a chemical burn to the eye includes irrigating the eye immediately with sterile normal saline or ocular irrigating solution. The irrigation should be maintained for at least 10 minutes. After this emergency treatment, visual acuity is assessed. Options B and C are not immediate measures. Question 9. The nurse is caring for a client after enucleation and notes the presence of bright red drainage on the dressing. The nurse should take which appropriate action? A. Document the finding. B. Continue to monitor vital signs. C. Report the finding to the healthcare provider. D. Mark the drainage on the dressing and monitors for any increase in bleeding. The correct answer is C. Report the finding to the healthcare provider. Rationale: if the nurse notes the presence of bright red drainage on the dressing, it must be reported to the healthcare provider because this can indicate hemorrhage. Options A, B, and D will delay necessary treatment. Question 10. A client is diagnosed with glaucoma. Which data gathered by the nurse indicate a risk factor associated with glaucoma? A. Cardiovascular disease. B. A history of migraine headaches. C. Frequent urinary tract infections. D. Frequent upper respiratory infections. The correct answer is A. Cardiovascular disease. Rationale: hypertension, cardiovascular disease, diabetes mellitus, and obesity are associated with the development of glaucoma. Smoking, ingestion of caffeine, or large amounts of alcohol, illicit drugs, corticosteroids, altered hormone levels, posture, and eye movements may cause varying transient increases in intraocular pressure.
That's all I have for this video. Please like, share, let me know if you have any questions. If not, I'll see you in the next video. Thanks for watching.